Acute glaucoma or angle-closure glaucoma, a condition in which an obstruction occurs at the access to the trabecular meshwork and the canal of scalum. Intraocular pressure is normal when the anterior chamber angle is open, and glaucoma occurs when a significant portion of that angle is closed. Glaucoma is associated with progressive visual field loss and eventual blindness if allowed to progress. This is most often an acute painful condition, not to be confused with chronic open angle glaucoma. Pathophysiology and etiology. Mechanical blockage of anterior chamber angle results in accumulation of aqueous humor fluid. Anterior chamber is anatomically shallow in most cases. The shallow chamber with narrow anterior angles is more prone to physiologic events that result in closure. Angle closure occurs because of pupillary dilation or forward displacement of the iris. Angle closure can occur in subacute, acute, or chronic forms. Episodes of subacute closure may precede an acute attack and cause transient blurred vision and pain, but no increased IOP. Acute angle closure causes a dramatic response with the sudden elevation of IOP, that is intraocular pressure, and permanent eye damage within several hours if not treated. Within several days, scar tissue forms between the iris and the cornea, closing the angle. The iris and ciliary body begin to atrophy. The cornea degenerates because of edema, and the optic nerve begins to atrophy. Clinical manifestations. Pain in and around eyes due to increased ocular pressure may be transitory attacks. Rainbow of color halos around lights. Vision becomes cloudy and blurred. Pupil mid-dilated and fixed. Nausea and vomiting may occur. Hazy appearing cornea due to corneal edema. Although onset may have initial subclinical symptoms, severity of symptoms may progress to cause acute symptoms of increased ocular pressure, intraocular pressure, nausea and vomiting, sudden onset of blurred vision, severe pain, profuse lacrimation, and ciliary injection. This type of glaucoma is a medical emergency and requires immediate treatment. Untreated, it can result in blindness in less than a week. Diagnostic evaluation. Tonometry. Elevated IOP, usually greater than 50 mmHg. Ocular examination may reveal a pale optic disc. Gonioscopy. Using special instrument called gonioscope to study the angle of the anterior chamber of the eye. Management. Pharmacology. Pharmacologic management. Emergency pharmacotherapy is initiated to decrease eye pressure before surgery. Medications are prescribed at the discretion of the ophthalmologist according to the patient's condition and needs. Medication classification prescribed include parasympathomimetic drugs used as miotic drugs. Pupil contracts, iris is drawn away from the cornea. Aqueous humor may drain through lymph faces, meshwork into canal of scalum. Carbonic anhydrase inhibitor restricts action of enzyme that is necessary to produce aqueous humor. Beta blockers, non-selective, may reduce production of aqueous humor or may facilitate outflow of aqueous humor. Hyperosmotic agents to reduce intraocular pressure by promoting diuretics. So 4 kind of drugs: parasympathetic mimetic drugs, carbonic anhydrase inhibitor, beta blockers, and hypersomatic agents. Surgery. Surgery is indicated if intraocular pressure is not maintained within normal limits by medical regime. There is progressive visual field loss with optic nerve damage, and types of surgery include peripheral iridectomy and Trabeculectomy. Peripheral iridectomy, excision of a small portion of the iris whereby aqueous humor can bypass pupil, treatment of choice, and most often a laser procedure. Trabeculectomy, 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 partial thickness scleral resection with a small part of trabecular meshwork removed, and iridectomy. Necessary if peripheral anterior adhesions scinctiae have developed due to repeated glaucoma attacks. Peripheral anterior adhesions, otherwise called scinctiae, Syneciae. Laser iridectomy, multiple tiny laser incisions to iris to create openings for aqueous flow may be repeated, and other eye is usually operated on eventually as a preventive measure. Complications: uncontrolled intraocular pressure that can lead to optic atrophy and total blindness. Nursing interventions must include relieving pain, relieving fear, and patient education and maintenance. Thank you.